name is Cheryl Erickson, and I'm the Indigenous focused ECE instructor with Louis Riel Vocational College. Today's video is going to be a summary of Chapter 8 in Nutrition, Health, and Safety. We're going to look at creating a climate of wellness for children in a daycare environment. Before we get started, I do want to remind you to please ensure that you are reading your chapters, as these videos are not a replacement for your chapter readings. So when we look at creating a climate of health and wellness for children, we're going to start off by just exploring what health and wellness means. So essentially, health is a state of physical, mental, and social well-being. So how we're feeling. Good health, not good health, so not good health meaning illnesses. So physical levels of health are how we're respecting our bodies and exercising our bodies and things like that. Mental health is the ability to function in developmentally appropriate ways in respect to self, family, and peers. And how we feel about ourselves and our self-esteem can be linked to that mental health. Wellness is optimal health, enjoying life, and just living our life to the fullness is a good wellness. How do we determine children's health and mental health? So some of the factors involved in there are social and economic environment. So social supports, networks, education, where the social economic factors are associated with children's health. So in terms of, do you need more supports? Poverty is often can be linked to poor health, and we'll get into that a little bit more as to why later in the slides, as well as your physical environment. So where you live can also be a factor linked to your health. The house, the type of house you live into, the community perhaps that you're living in, and characteristics and behaviors as well. So age, gender, genetics, and also healthy behaviors. And so some of those healthy behaviors are associated with how we're raised and can be factors in our socioeconomic and our physical environment as well. So they're all very much linked together. So when we look at factors and how we determine children's health and health risks, to be exact, can contribute to illnesses and diseases. So poverty, inadequate housing, dysfunctional family, poor access to healthy foods can affect how your body is growing and developing, and can affect you disease-wise. So inadequate housing, so not having a house that's warm enough, a house that has mold, can lead to certain health issues, breathing issues. Poverty could mean the types of meals that you're eating. Access to healthy foods could be the cost, could be associated to money. It could be where your community is, where you're living. You might not be able to eat certain foods. You might not be able to get fresh fruits and vegetables. So things like that are determinants of children's health. There's also protective factors that promote health and wellness. And so having said that, it's those warm relationships, it's those attachments that are important in connection and how children are feeling safe and secure. It's also wholesome, healthy foods, having access or not having access, and how that can affect you health-wise. And positive social support networks. So if there is an issue and there is a network out there to support a family, that will affect a child's health in a positive way. If there are no supports and things remain as they are, a child will be in an unhealthy environment and therefore suffer from poor health themselves. So how can we as ECEs influence health and wellness. What can we do within our environments and our daily practices to support children and their families? So one of the things would be to provide a safe environment where children can explore, play outside, be safe, whether they're indoors or outdoors within our environments. And so we know that fresh air in a physical activity is a really good way to achieve a healthy lifestyle. Offering school health screenings. So we are big in Manitoba. I can't speak to the United States or other parts of Canada, but we are really good at early years screening in terms of entering childcare programs for pre-screening, as well as pre-screening for school. So there are a lot of resources available out there, and teams, educators as far as school resource, that do these screenings specifically to find children at young ages that may have delays or not progressing developmentally, and get those resources to them as soon as they can to help support them so that they are successful when they start that education program. So those are really good tools to support children in their health and wellness, as well as finding out what resources are available in your community and promoting them to the children and the families in your care. Oral health promotion, we know that as early care, early childhood professionals, that dental health is really important. A lot of illnesses and diseases start within the mouth and that bacteria. And so a child with a infection in their mouth, if not treated, could lead to other conditions and illnesses, to a blood infection could even occur, worst case scenario. So we know that dental screening, that first visit to the dentist is really important, and often that is free for families. We can incorporate toothbrushing within the daycare environment, and in fact a lot of centers do that because they know the importance of oral health, and they teach children. They invite dental practitioners into their environment to teach and work with children, and even going as far as providing toothbrushes every 6 months to ensure that children are brushing their teeth at home, and that toothbrush is fresh and new every 6 months so that it's doing the job that it's supposed to do. In our environments, we can also read stories about dental health and dental practices. There's a lot of books pertaining to specific health practices in early years. So we want to encourage those, and we can even lend those resources to families so that they are able to have those teachable moment opportunities at home too. Promoting physical activity, our daily schedule is going to be the biggest factor in how we promote physical activity. So we're going to have lots of opportunities for children to play indoors and outdoors, those large motor activities. And large motor, I mean moving their whole body, running, jumping, skipping, climbing. All of those are really good opportunities for exercise and really physical activity. So we want to incorporate that into our day every day, and we want to talk about that in our policies and in our procedures. And those policy manuals we are going to give to the parents at the start of their daycare experience with us, or their care experience with us. And we do that because it teaches the parents why we have the practices that we do, why that is important. And we're also going to offer more open areas, more green space, more opportunities for children to be exposed to the environment and that fresh air. The forest nature type of schools that have opened up all over the city, because we really need to get back to nature and those practices of the past, because they're missing now, and we realize the importance of it. How do we promote this acceptance within the classroom? You know, the daycare center isn't a classroom per se, but we do incorporate these practices into our environment by, you know, just teaching children, talking to them about it, explaining it to the families, you know, why we have the practices that we do. We model acceptable, appropriate behaviors, and we offer children those opportunities to develop their skills in negotiating and problem solving. Respecting, you know, respecting others, do unto others. So those types of practices are really important. And because we have a high number of new comers to our childcare programs, we really need to get the word out there. And often it's hard to pass along that communication if you have families that aren't speaking English, the English language that you're using. And so, you know, finding opportunities to communicate that information, often an interpreter is a good start in being the go-between and helping the parents to understand what your practices are, or finding the, you know, resources, the links within your community that can help again with that communication process. So we want to make sure all our families understand what we do to promote that good health and wellness out there too. So being a good advocate, if you can find volunteers or new staff that speak many different languages, that will be a really huge asset to your program in all regards. So that does conclude Chapter 8 of Nutrition, Health, and Safety. Please do see your instructor if you need clarification on anything that we discussed, as well as check in to ensure that you haven't missed any handouts or assignments pertaining to Chapter 8.